Hello, Golden Vitality family. Have you ever wondered what doctors and wellness experts wish every senior knew about intimacy and self-care after 60? In today's warm, honest video, we'll gently bust myths and uncover the powerful truth about senior health, vitality, and private self-care practices like masturbation. Stay with us. You deserve to know. Hello, and a very warm, sincere welcome to you from your friends here at Golden Vitality. We're truly glad you're choosing to spend some time with us today. Here, we celebrate the journey of aging, viewing our 60s, 70s, 80s, and beyond not just as years passing, but as rich chapters filled with wisdom, experience, and ongoing opportunities for health, happiness, connection, and personal fulfillment. Part of embracing this journey fully means feeling comfortable and informed about all aspects of our well-being. This includes topics that touch upon our physical health, our emotional balance, and sometimes aspects of our lives that feel quite personal or private. We believe that open, honest, and respectful conversations about all these areas are essential for living our best lives. Today, we want to gently open a conversation about one such area, something often considered a private matter, yet something that touches on natural human experience and well-being. We want to explore what every senior should know about this private matter, specifically focusing on self-pleasure or masturbation. In the context of healthy aging, our goal is simple: to provide clear, compassionate, accurate information based on current understanding from health experts. We want to approach this like a caring doctor, wellness coach, or trusted counselor might, with warmth, respect, and a focus on empowering you with knowledge. There's no room here for judgment, embarrassment, or outdated thinking. This is about understanding ourselves better and making informed choices that support our dignity, freedom, and overall vitality. As always, while we aim to offer helpful insights, this conversation is for general knowledge. Your personal health situation is unique, so please always feel comfortable chatting with your own doctor or a trusted healthcare provider for advice tailored just for you. They are your very best resource. Life unfolds in fascinating ways as we age. We might find deep satisfaction in nurturing a garden, feeling the connection to the earth and the quiet miracle of growth. Perhaps it's the irreplaceable joy of sharing laughter and stories with grandchildren, seeing the world anew through their eyes. Maybe we find purpose in volunteering our time and skills, staying connected to our communities. Or perhaps it's the simple, profound pleasure of losing ourselves in a good book, pursuing a long-loved hobby, or enjoying the peace of nature. These are the threads that weave the rich tapestry of later life. Within this tapestry, our relationship with our own bodies continues. We become more aware of physical changes, perhaps focusing more consciously on maintaining strength, flexibility, and energy. Part of this physical self includes our natural capacity for intimacy, connection, comfort, and pleasure. While societal myths sometimes suggest otherwise, these needs and capacities don't simply vanish with age. Self-pleasure, or masturbation, the private act of touching one's own body, usually the genitals or other sensitive areas, for pleasure, often leading to arousal and sometimes orgasm, is a part of this picture for many people. It's a natural human behavior, recognized by health professionals as common and generally safe across the lifespan. However, because it's often considered a private matter, it's frequently surrounded by silence, questions, or even lingering misinformation from years past. What should seniors know about this? Is it still relevant? Is it safe? Does it offer any benefits? Does it change as we age? Let's explore these important questions together, drawing on what health experts understand today. 1. Acknowledging normalcy and dispelling myth. Perhaps the most important thing every senior should know is this: masturbation is widely considered by medical and psychological experts to be a normal, common, and generally healthy aspect of human sexuality throughout adulthood, including in later life. Age is not a barrier. There is no magical age at which this natural capacity or interest suddenly becomes inappropriate or unhealthy. Many people continue to engage in and enjoy self-pleasure well into their 70s, 80s, and even 90s. If they feel the desire and are physically comfortable doing so, the decision is entirely personal, not dictated by age. Debunking harmful myths for centuries. Unfounded myths cause unnecessary fear and shame. You might have encountered claims that masturbation causes blindness, physical weakness, insanity, infertility, or other serious problems. Let us state this clearly and unequivocally. These claims are absolutely false. There is no scientific or medical evidence to support them. They stem from historical anxieties, lack of understanding, or moral judgments, not biological fact. Experts confirm that for most healthy individuals, the act itself is physically benign. Understanding this foundation of normalcy and safety helps remove any lingering stigma or unwarranted concern, allowing for a more open and honest consideration of the topic. 2. Understanding potential benefits for well-being. Experts don't just view masturbation as not harmful. Many recognize its potential to contribute positively to overall well-being, particularly in ways relevant to common challenges faced in later life. These aren't guaranteed outcomes for everyone, but potential benefits rooted in our body's natural responses. Natural stress relief. Life after 60 certainly has its stressors: health concerns, financial worries, family matters, world events. Chronic stress negatively impacts both physical and mental health. Orgasm triggers a potent release of natural chemicals like endorphins, mood boosters, and oxytocin, the calm and connect hormone. Oxytocin helps lower levels of the stress hormone cortisol. This physiological response provides a natural, built-in mechanism for deep relaxation and tension release. Think of it as a safety valve for releasing accumulated stress. Accessible anytime in private. A potential aid for sleep. Sleep difficulties are common among seniors. The profound relaxation following orgasm, combined with the release of hormones like prolactin linked to sleepiness, can make it easier for some individuals to fall asleep and perhaps enjoy more restorative rest. For those struggling with restlessness or anxiety at bedtime, it can be a gentle, natural pathway towards slumber, without the potential side effects of medication. Mood enhancement. Feelings of loneliness, sadness, low spirits can occur. The release of endorphins and dopamine, the pleasure chemical during orgasm, provides a natural mood lift. It can offer a temporary respite from negative feelings, generate a sense of satisfaction, and serve as a reminder of the body's capacity for pleasure and joy. Important affirmations at any age. Pain management, a subtle assist. Those wonderful endorphins also act as natural painkillers. While not a primary treatment, some individuals with chronic pain like arthritis report experiencing temporary relief following orgasm. Even short-term relief can improve quality of life. Body connection and acceptance. As our bodies change with age, it's easy to feel disconnected or critical. Focusing on physical sensation through self-pleasure can be a positive way to reconnect with your body, appreciate its resilience, and foster acceptance. It shifts focus from appearance to the experience of physical comfort and pleasure, potentially boosting self-esteem. Sense of control and empowerment. Aging can sometimes involve feeling less in control of certain aspects of life. Choosing to engage in self-pleasure is an act of personal autonomy, taking ownership of one's own comfort and pleasure. This sense of self-determination can be quietly empowering. Maintaining sexual function. Experts often suggest that regular sexual activity, partnered or solo, helps maintain blood flow and tissue responsiveness in the genital area, a use it or lose it principle to some extent. Potential physical benefits. Some research suggests possible links between regular ejaculation and better prostate health for men, though not a substitute for screening. And the muscle contractions during orgasm can help maintain pelvic floor tone in women, important for bladder control. These are generally considered secondary or potential added benefits. Knowing about these potential positive connections allows seniors to view self-pleasure not just as neutral, but potentially as a tool for self-care and well-being, if they so choose. 3. Recognizing the need for adaptation and safety with age. While the activity itself is generally safe, how we approach it might need to change or adapt as our bodies change. This is crucial information for ensuring comfort and safety. Hormonal changes matter. For women after menopause, drastically lower estrogen levels very commonly lead to vaginal dryness, thinning tissues, and reduced elasticity, GSM. This can make touch painful or cause irritations or tears without lubrication. This is a key physiological change to be aware of. For men, gradually declining testosterone can sometimes affect libido, the firmness or duration of erections, or the sensation of orgasm. Physical comfort is paramount. Lubrication is often key, especially for women. Using a water-based or silicone-based lubricant is often essential for comfortable, pain-free stimulation. It's a simple, effective adaptation to hormonal changes. Gentleness is why skin can become more delicate. Being gentle prevents irritation. Listen for pain. Pain is a signal to stop, adjust, or seek medical advice if persistent. Comfortable positions. Use pillows for support to accommodate arthritis, back pain, or mobility issues. Experiment to find what works. Health conditions require awareness. Heart health, while safe for most with stable conditions comparable to mild exercise, those with severe or unstable heart conditions must consult their doctor before engaging in any sexual activity due to the temporary increase in heart rate blood pressure. Post-surgery. Always follow surgeon's instructions regarding resuming physical activity. Other conditions, diabetes, neurological issues, or chronic pain might affect sensation or comfort, requiring extra care or adaptation. Medications can have effects. Many common drugs can impact sexual desire or function. Discussing bothersome side effects with your doctor is important. Don't stop vital meds. Assistive devices, vibrators, or massagers can be helpful if hand dexterity or reach is limited. But choose body-safe materials and keep them clean. Knowing how to adapt makes it possible to continue enjoying self-pleasure safely and comfortably, even as our bodies evolve. It's about working with your body, not against it. Or understanding that choice and desire are central. Perhaps the most important aspect is that engaging in self-pleasure is entirely a personal choice. No obligation. There is absolutely no medical or social requirement to masturbate. If you have no interest, that is perfectly normal and valid. Your worth and well-being do not depend on it. Respecting personal values. If the activity conflicts with your deeply held personal, cultural, or religious beliefs, or causes significant emotional distress, guilt, shame, honoring those feelings is crucial for your psychological well-being. Desire can fluctuate. Interest in sex and self-pleasure can naturally change throughout life due to health, medications, stress, relationship status, or simply personal inclination. It's okay if your desire changes over time. Experts emphasize autonomy and informed choice. The information about potential benefits or safety is provided to empower individuals, not to pressure them. 5. The importance of open communication when appropriate. While masturbation is a private matter, related health concerns shouldn't be suffered in silence. Seniors should know it's okay, and often important, to talk to trusted healthcare providers about pain during any sexual activity, partnered or solo, bothersome vaginal dryness or discomfort, changes in erectile function, concerns about libido changes, How medications might be affecting sexual function. Safety questions related to specific health conditions. Doctors and other healthcare providers are trained to handle these topics professionally and confidentially. Open communication allows for proper diagnosis. Effective treatments like lubricants, vaginal estrogen, ED medications if appropriate, medication adjustments, and personalized advice, ultimately supporting both health and quality of life. Putting it all together, key takeaways for seniors. So, what should every senior know about this private matter? It's normal and generally safe. Masturbation is a common human experience, not harmful or wrong for most healthy adults. Regardless of age, disregard outdated myths. Potential benefits exist. It can contribute positively to well-being through stress relief, better sleep, mood enhancement, body connection, and possibly other subtle health links, thanks to natural hormone release. Adaptation is often necessary. Bodies change hormones. Mobility, using lubrication, especially the women, being gentle, finding comfortable positions, and managing expectations are key adaptations for continued comfort and safety. Listen to your body. Pain is a signal to stop/adjust. Persistent issues warrant a doctor visit. Specific health conditions require caution, especially severe, unstable heart disease. Always get doctor clearance for sexual activity. Follow post-surgery instructions. Choice is paramount. There's no obligation. Respect your own desires, values, and emotional comfort. Lack of interest is perfectly okay. Talk to your doctor. Don't hesitate to discuss related health concerns. Pain, function changes, medication effects with your provider. Knowing these things helps integrate this personal aspect of life into a broader understanding of healthy aging. It allows for informed choices, promotes self-care, and supports the values of dignity, freedom, and personal fulfillment. It's about acknowledging our whole selves, physical, emotional, and sensual, and nurturing our well-being in ways that feel authentic and supportive throughout our entire lives. Think of it like maintaining a cherished old car. You know it needs good fuel nutrition, regular drives exercise, and proper maintenance medical care. You also know that sometimes you need to adjust how you drive it, maybe take corners a bit slower, gentleness. Use a cushion for back support, adapting positions. Or make sure the fluids are topped up, lubrication. You don't stop valuing the car or enjoying the ride just because it requires mindful care. You learn what it needs now to keep running smoothly and bringing you joy. Understanding your body and its needs regarding intimacy and pleasure in later life follows the same loving, practical principle. Thank you for joining us at Golden Vitality for this open and considerate exploration of what seniors should know about the private matter of self-pleasure. We hope this information has been clear, reassuring, and empowering, helping you feel more knowledgeable and confident about your own well-being. Remember, your journey is unique, and the choices you make about your body and your life are yours alone. If you have specific health questions or concerns related to this topic or any other aspect of your health, please do reach out to your doctor or another trusted healthcare professional. They are your best partners in navigating your path to continued health, vitality, and a fulfilling life. Take wonderful care of yourself. Stay informed and embrace your journey with grace and confidence. Be well.